Hello, my name is Gail Hobson, and I am a family nurse practitioner who is currently pursuing her doctor in nursing practice and a postmaster's degree in mental health. I am presenting a video with my stakeholder education plan for weight and body mass indices, BMI reduction for pediatric patients within an outpatient setting for a 5-month time frame. The stakeholders in the study will engage in meetings, patient encounters, and other activities or projects to meet the goals of the study. The equipment used consists of weight loss measurements, patient education, dietary aids such as the MyFitnessPal mobile application, and physical activity motivators such as a Fitbit fitness tracker. By focusing on this medical disorder that is commonly seen in primary care practices, I felt that an implementation plan to meet the needs of decreasing the incidences of pediatric obesity would be of interest. Pediatric obesity has emerged as one of the most prevailing health concerns in the United States, US, and worldwide. Currently, 1 in 3 children in the US is afflicted with a diagnosis of overweight or obesity, and the prevalence of childhood obesity is associated with the emergence of comorbidities previously considered to be adult diseases, including type 2 diabetes mellitus, hypertension, non-alcoholic fatty liver disease, obstructive sleep apnea, and dyslipidemia. According to Hasnick 2014, risk factors for obesity can be identified as being genetic or medical disorders, parental obesity, nutritional imbalance, decreased activity patterns, and/or drug therapy. For an intervention program to meet the needs of the obese pediatric population to be created, stakeholders must be identified and educated to meet the requirements of the patient and intervention program. Stakeholders are defined as those with an interest or stake in an activity or its evaluation, and quality improvement practitioners who are already encouraged to think about all the people who might be affected by the project, especially those who are adversely affected. The stakeholders for this project consist of the patients, their families, the healthcare provider, or HCP, who is either a medical doctor, MD, or a nurse practitioner, NP, the registered nurse, or RN, the registered dietitian, or RD, personal trainers, medical assistants, MAs, or clerks, and the program director. Although each stakeholder in this study has a different role or interest in the study, they all require and need information or specific recognition of their involvement and may desire a role in interpreting the study's results. The roles of the stakeholders for this project are as follows. The patient is an active participant within an evidence-based practice, EBT, study, who plays a key role in the design, feasibility, quality, and goals of the study. The family consists of parents, guardians, caregivers, and/or siblings who are behavioral role models and gatekeepers for the home. The HCP, NP, or MD is the provider who has the medical and scientific knowledge and feasibility to evaluate the patients by performing pre- and post-study physical examinations and evaluating lab data, monitors the progress of the study's design, evaluates protocols, and presents the data to the Institutional Review Board, or IRB. This individual is the main source of health information and education for many families throughout the study. The RN facilitates with the HCP in a research project by organizing and assessing patients or test subjects, medical histories, physical, and/or psychological health. The RD determines nutritional programs that meet clinical guidelines and are tailored to meet the needs of the patient. The personal trainers motivate, educate, and provide constructional feedback to assist patients to meet their physical fitness needs and goals. The MA directly supports healthcare professionals such as nurses or the HCP in performing clinical duties and clerical tasks. The program director oversees and manages the clinical project by reviewing and analyzing clinical trial timelines, budgets, resources, vendors, and ensures that established key performance indicators are in alignment with the project's objectives and goals. The educational needs for each of the stakeholders in the study vary according to each individual's role in the project. The patient will be given educational materials to assist in their goal of BMI reduction from the HCP, RN, RD, MA, and personal trainer that is tailored to meet their needs. The family will also receive educational instructional material to assist the patient in meeting the goals in the home, school, work, and social environments outside of the clinical setting. The HCP will be able to use their medical background to assist the other healthcare practitioners aid the patient in meeting their goals. The HCP will also learn from the different stakeholders, such as the RD and personal trainer, how to implement techniques they have used with the patient during the study to meet the patient's BMI reduction goals. The RN and MA will work together to measure and evaluate the anthropometric measurements for study data, gather the results for the questionnaires, provide educational support to the patients during the study. The RD will provide one-on-one dietary assessments, gather and assess the patient's balance of energy input and output via exercise and diet, and lead bi-monthly stakeholder group meetings to discuss the progress of each patient's weight reduction program. The RD will also consult and construct personalized interventions with other healthcare practitioners, such as the HCP and RN, to determine each patient's needs. The personal trainers will be instructed on the medical histories of their assigned patients and educated on the activity levels each patient can engage in so that they can tailor a physical activity program that will suit their patient's needs. The program director will be educated on the clinical outcomes of the study via clinical data and questionnaires and provide analytical results needed via computer software in order to determine the effectiveness of the study. The theoretical models or frameworks offer nurse educators and researchers the opportunity to use nursing theories to give educational opportunities to advance nursing knowledge base via empirical work. The theoretical framework that is used for this study is the narrative circle model for nursing education and research, or the NCM-NER. This model puts the nurse researcher at the center of the circle, in which they play an important part in the power and significance of each discipline of a research study, and the participants, researcher, places, and events are in the continuous cycle which is guided by the research methodology of the critical social theory and narrative inquiry. Narrative inquiries for this theoretical model are primarily in the educational curriculum and research methodology. In regard to narratives in the educational curriculum, the NCM-NER allows nurse educators to provide narratives based on evidence-based research that can influence educational curriculum and the future of nursing education. The narratives from research methodology allows the nurse researcher to view the phenomenon they are studying as a narration that extends over time, that is shaped by personal and social conditions, and is placed according to the lived experiences of the narrator. According to McIntyre 2018, the process described in the NCM-NER involves ultimately moving towards social change with a desire to improve education and practice for newly graduated registered nurses. The reason why the narrative circle model for nursing education and research theory was chosen is due to my future goal of becoming an instructor, mentor, and preceptor for newly graduated registered nurses who will probably serve as nurse researchers in the future. In order to preserve the evidence-based practice protocols that nursing interventions uphold, registered nurses with various educational backgrounds must be able to validate how education is transferred from theory into practice in all disciplines. For this study, the NCM-NER model will allow the advanced practice registered nurses, APRNs, and RNs to communicate effectively to improve the social and physical statures of the participants involved in the study in order to gain outcomes that are reflective of current research based on the reduction of pediatric BMIs. For the stakeholders, we must focus on several variables that can affect the outcomes and effectiveness of this study. The variables that will be studied are participant satisfaction, project costs, and clinical outcomes. The management tool that will be used to assess the changes in BMI for the study participants is the International Physical Activity Questionnaire, or the IPAQ. The IPAQ is a self-administered questionnaire that evaluates physical activity and reduced sedentary behavior for young and middle-aged adults between the ages of 15 to 64 years. Questions on the IPAQ pertain to the number of days and average time spent on a given day doing moderate to vigorous physical activity in 5 domains consisting of work, transportation, garden or yard, home, and leisure time, and is considered a direct physical measure of an individual's physical activity behaviors. This questionnaire will be administered to the subjects prior to the start of the program and at the end of the 5-month time frame. The questionnaire will be administered in an online survey that is accessible via smartphone, tablet, or computer. By examining the results of the pre- and post-questionnaires, we will be able to gain data that will support the effectiveness of the interventions for reduced BMIs for the study participants. In studying the project costs and clinical outcomes, a cost-effective analysis will be conducted. According to Duke Global Health Institute 2014, childhood obesity has an estimated price tag of $19,000 per child compared to a normal weight child. By conducting a cost-benefit analysis, we can explore the cost per unit health outcomes obtained with an experimental intervention versus usual care to measure the value obtained for the money spent and may be used to guide resource allocations. One measure to assess this is by using the short form 6 dimension or SF6D. To estimate the dollar value of a quality adjusted life years, QALYS, by estimating the willingness of a participant to pay using an instrumental variable approach. The SF6D allows researchers to use data from 8-dimensional scores for the effectiveness of physical and mental health results and provides an economic evaluation by estimating QALS. It says from a sample population. By using the SF6D, we are able to measure whether diet and physical activity will provide value in terms of quality adjusted life years. In conclusion, in order to gain a complete picture for an intervention program to reduce the BMI of obese pediatric patients, we must address the needs of the stakeholders and address the factors that can affect the results of the study, such as clinical outcomes and the cost effectiveness of the study as a whole. Thank you for your interest in my project, and if you have any comments or questions, please do not hesitate to contact me at Hobson, Hobson, @mail.brandman.edu. Thank you.